For decades, the medical field has basically treated female sexual dysfunction as this vague psychological hurdle, or a stress issue, or maybe just a simple hormone deficiency.
Yeah, the solutions offered to women have historically been just frustratingly vague.
Right. Like you might be told to just reduce your stress, or you might be prescribed synthetic hormones. Or in like really severe cases of pelvic floor dysfunction, they might even offer invasive surgery.
Exactly. It's always been either a Band-Aid or something really extreme.
But what if the ultimate cure, like a literal regenerative serum capable of rebuilding tissue from the inside out, had just been flowing through your own veins this entire time?
I mean, it sounds like something straight out of a futuristic sci-fi novel, honestly.
It really does. But today we're taking a deep dive into this bold, kind of crazy-sounding claim that is circulating literally everywhere in the world of women's intimate health right now. We are asking, can an injection of your own blood actually regenerate vaginal tissue and significantly heighten G-spot sensitivity?
And while it sounds like science fiction, the underlying mechanism we're looking at today is actually rooted in some incredibly well-documented regenerative biology. We're talking about utilizing the body's own localized repair systems to literally reverse tissue atrophy.
And we have a massive stack of sources in front of us today to help you, the listener, understand exactly what is going on here. We are looking at the glossy marketing claims from those super high-end aesthetic clinics in like London and California.
Right, where they sell this procedure as the O shot or the orgasm shot.
Exactly. But we aren't just taking their word for it. We are weighing those clinic claims against actual peer-reviewed systematic reviews. And that includes a brand new, really comprehensive 2026 randomized controlled trial that was just published in the Journal of Obstetrics and Gynecology.
Which is a huge deal in the medical community.
It is. So our mission today is to separate the clinical reality from the aesthetic clinic hype. We're going to break down what this serum actually is, how it interacts physically with the anatomy of the G-spot, and what the latest clinical data actually proves about its real-world effectiveness.
Right, because to understand how a simple injection can theoretically improve physical sensitivity, we first have to understand the material inside the syringe.
Yeah, because we are not talking about a pharmaceutical drug formulated in a lab somewhere.
No, not at all. The procedure utilizes autologous platelet-rich plasma, or APRP.
And that word autologous is really key here. It simply means the material comes entirely from your own body, like you are your own donor.
Which eliminates so many complications right out of the gate.
Exactly. So the process itself starts out looking exactly like a routine physical. You go into a medical office, and they just do a standard blood draw from your arm.
But they aren't just taking that whole blood and injecting it straight back into the vaginal tissue. That wouldn't give you the concentrated regenerative effect they're looking for.
Right. So what happens to the blood after they draw it?
So the blood sample is immediately placed into an FDA-approved centrifuge. This is a machine that spins the vial of blood at incredibly high speeds, creating this massive centrifugal force.
Okay.
And because the different components of your blood have entirely different densities, the spinning physically separates them. So the heavier red and white blood cells get forced to the very bottom of the tube.
And that leaves the plasma and the platelets just kind of suspended at the top, right?
Exactly. They sit right at the top in this sort of golden, clear liquid.
It makes me think of like your blood being a really complex smoothie. You've got strawberries, kale, blueberries, yogurt, all blended together. And the centrifuge acts like this hyper-advanced biological filter that extracts only the specific repair crew ingredients.
That's a great way to look at it. It pulls out just the platelets and a small amount of plasma, and it leaves the rest of the smoothie behind.
Leaving you with a highly concentrated, entirely natural fertilizer.
And that concentration level is huge. The resulting plasma typically contains 1.6 to 6 times the normal concentration of platelets compared to what is naturally flowing through your bloodstream on any given day.
Wow, 6 times. I mean, most of us really only think about platelets when we get a paper cut, like we know they are the microscopic cells that rush to a wound to clot the blood and form a scab so we don't bleed out.
Right, and they do form clots, absolutely. But their role in the body's healing cascade goes so much deeper than just plugging a physical hole.
How so?
Well, platelets are essentially these microscopic cargo ships, and they are packed with what we call alpha granules. Inside those granules are massive payloads of growth factors, bioactive proteins, and signaling molecules.
Oh, wow. So they're carrying all the repair instructions.
Precisely. When you sustain a physical injury, the platelets rush to the site, clot the bleeding, and then they degranulate, meaning they literally burst open and release all of those growth factors into the surrounding tissue.
Which act like a biological siren, basically. They signal your body's local dormant stem cells to wake up, migrate to the area, and get to work repairing the damage.
Yes. So, by drawing the blood, isolating just those platelets, concentrating them, and then purposefully injecting them into a specific area, the clinician is essentially tricking the body.
Tricking it how? Like making it think there's an injury.
Exactly. They initiate that massive biological healing cascade without there being an actual wound. When this platelet-rich plasma is injected into vaginal tissue, the concentrated growth factors trigger localized fibroblasts to just ramp up collagen production.
Which restores the physical elasticity to the vaginal walls.
Right. And they also stimulate something called neovascularization.
Neovascularization, that's a mouthful. That's
Yeah.
the physical formation of brand new capillary beds and blood vessels, right?
You got it. And more blood vessels mean a much higher capacity for blood flow.
And better blood flow is like the fundamental mechanical requirement for sexual arousal, for natural lubrication, and just overall tissue health.
Absolutely. Because when estrogen drops, say due to perimenopause or menopause, or when tissue is damaged through the trauma of childbirth, those local capillary networks can physically shrink.
The tissue essentially becomes a bit of a desert.
Yeah, that's exactly what atrophy is. So this PRP serum is basically building a brand new irrigation system to bring that desert tissue back to life.
Okay, so we have this concentrated biological repair serum ready to go in the syringe. According to the medical protocols in our sources, the procedure involves applying a strong topical numbing cream to the vaginal area to, minimize discomfort.
Which is very important.
Right. And then the PRP is injected into very specific target zones. The primary injection sites are the clitoris and the distal anterior vaginal wall.
The anterior vaginal wall being the front wall of the vagina, situated right up against the urethra.
And the sources note that this specific region is the precise anatomical location of the Grafenberg spot, or what we all colloquially know as the G-spot.
Right.
But here is where the biology kind of crashes into a cultural debate, because I have to question the logic here. We're talking about injecting a highly specific, very expensive serum into a physical structure that a large portion of the medical community argues might not even exist.
It's true. The G-spot has been famously elusive.
Right. So how do doctors know exactly where to put this needle to guarantee a change in physical sensitivity if they can't even agree on what the G-spot is?
Well, that debate is actually one of the most fascinating aspects of modern gynecological science. The confusion really stems from older medical models. They were looking for a distinct, isolated organ, like a literal button hidden somewhere inside the vaginal wall.
Which they couldn't find.
Exactly. But we now know through advanced MRI imaging and modern anatomical mapping that the G-spot isn't a single button at all. It is much better understood as a highly complex neurovascular bundle.
So it's a network, not a solitary switch.
Yes. The anterior vaginal wall, the urethra, and the internal wishbone-shaped legs of the clitoris, they all physically intersect in this one specific zone.
Oh, I see.
And because all these structures meet there, this localized area has the absolute highest density of nerves and blood vessels in the entire pelvic region.
It's basically the grand central station of the pelvic floor's nervous system.
Perfect analogy. And over time, because of the natural aging process or hormonal shifts or childbirth, the tissue in this specific neighborhood can thin out.
Which you mentioned earlier, the atrophy.
Yeah.
The blood flow decreases, and because the nerves aren't getting the oxygen and the nutrients they need, they just become significantly less responsive.
Exactly. So by taking that highly concentrated PRP and injecting it directly into this dense anterior wall, those growth factors go to work on the entire complex.
They rebuild the thinning mucosal tissue.
Right. They enhance the health of the local nerve endings, and they dramatically increase the vascular network feeding all those internal clitoral structures.
So mechanically speaking, physical rejuvenation of the tissue naturally translates to heightened sexual arousal.
It does.
Because if the biological hardware, like the mucosal lining, the nerve endings, the capillary beds, if that's all suddenly functioning at a younger, healthier capacity, it simply takes less stimulation to trigger natural lubrication and engorgement.
Which naturally leads to much stronger orgasms. It's a very clean, very logical narrative. Rebuild the tissue, get more sensitivity.
The biological theory makes perfect sense on paper, I'll give you that.
Right.
But the reality is that private clinics are capitalizing heavily on this clean narrative. Um, you could look at aesthetic clinics in London right now that are charging upwards of £1,300 for a single O-shot.
Yeah, the price tag is substantial.
It is. And when you attach £1,300 to a promise of heightened intimacy, we really have to look past just the biological theory. We have to demand rigorous clinical proof. We need to see what happens when these claims are subjected to the actual scientific method.
And thankfully, the scientific community has been aggressively investigating this. The data we have is incredibly robust.
Let's talk about that data.
Okay, so the most compelling piece of evidence in our sources today is that 2026 randomized controlled trial, the one published in Obstetrics and Gynecology.
Right.
The researchers purposely designed this study to cut right through all that marketing noise. They took 52 premenopausal women. All of these women were sexually active, but crucially, all of them were actively experiencing and medically diagnosed with female sexual dysfunction.
Okay, so they randomized these 52 women into two distinct groups. Half of them received the actual autologous PRP injection right into the distal anterior vaginal wall.
And the other half.
The other half received a placebo injection, which is just simple saline water.
And utilizing a saline placebo for an injectable treatment is so vital here.
Why is that? Just to trick them?
Well, it isolates the biochemical effect of the actual platelets from the mere physical action of receiving a needle in the tissue.
Oh, because just getting stabbed with a needle does something.
Exactly. Just the physical poke alone can sometimes cause localized swelling or trigger a temporary immune response that might mimic a treatment. So the saline controls for that.
That makes total sense. So the researchers tracked these participants using a standardized metric called the Female Sexual Function Index, or the FSFI.
Right, which is a very comprehensive questionnaire. It evaluates 6 different domains: desire, arousal, lubrication, orgasm, satisfaction, and pain.
And the results from this are just stark. At both the 6-week mark and the 6-month mark post-injection, the women who received the actual PRP showed a significantly greater increase in their total FSFI scores compared to the women who just got the saline placebo.
Yeah, the PRP group demonstrated marked statistically significant improvements across almost all of those individual subscales, particularly in natural lubrication and arousal.
Okay, but I have to play devil's advocate here for a second.
Go for it.
Because sexual satisfaction is notoriously complicated, and it is deeply fundamentally tied to our mental state and our psychology.
Yeah, absolutely.
So if a patient is walking into a high-end clinic and they are paying £1,300 for a heavily marketed shot that promises to fix their sexual dysfunction, they're going to desperately want to feel a difference.
They're financially and emotionally invested.
Exactly. The brain is incredibly powerful. So how do we know this isn't just an incredibly expensive, highly effective psychological placebo effect?
It's a totally valid question. The placebo effect is one of the most powerful phenomena in medicine, and it is particularly potent in the field of sexual health.
All right.
But the researchers knew this, which is why the data from that 2026 saline trial is so important to break down. They utilized a secondary metric alongside the FSFI called the Patient Global Impression of Improvement, or PGII.
Which measures what exactly?
It measures the patient's own subjective feeling of whether their condition has actually gotten better since the treatment.
Okay, let's look at those numbers then. At 6 weeks post-injection, nearly 69% of the women in the actual PRP group reported an overall improvement in their sexual function.
And in the saline placebo group.
42% of the women in the placebo group also reported an improvement.
And there it is. That 42% is the placebo effect in action. Almost half the women who received simple salt water genuinely felt better, which totally proves your point about the psychological power of just receiving a medical treatment.
Right. But the PRP group at 69% still vastly outperformed that psychological effect.
They did. But what's even more revealing is what happens at the 6-month mark.
Right, because the psychological placebo effect notoriously fades over time as the novelty of the treatment wears off and baseline reality kind of sets back in.
Exactly. But at 6 months, the women in the PRP group were still holding steady, with 69% reporting continued improvement. The physiological changes from the tissue regeneration were lasting.
Wow.
Meanwhile, the placebo group experienced a sharp drop-off, falling all the way down to 34%.
Okay, so the actual biological changes from the growth factors maintained a statistically significant edge over just the power of suggestion.
Exactly. And importantly, the 2026 trial does not stand alone here.
Right. The sources also include a really comprehensive 2023 systematic review that was published in the journal Biomedicines.
And this review cast a much wider net. It aggregated data from 12 different clinical studies covering a total of 317 women.
And the consensus across those dozen studies totally mirrored the 2026 trial. PRP therapy resulted in broad, significant improvements for desire, arousal, lubrication, and the ability to reach orgasm.
Right. When you combine the established biological mechanism, the platelet degranulation and the neovascularization, with a dozen clinical studies and a rigorous placebo-controlled trial, the evidence really graduates.
It moves out of the realm of just anecdotal clinic marketing and firmly into the territory of validated medical science.
It does. The data clearly shows genuine, measurable improvements in tissue health and G-spot sensitivity.
But before anyone listening decides to immediately log online and book an appointment, we have to look at the practical reality of this treatment.
Yes, a reality check is definitely needed.
Because we need to look at the actual clinical protocols, the safety profile, and the very real limitations of the current science. The glossy brochures at those aesthetic clinics don't always give you the full medical picture.
They definitely don't. And the branding itself is actually the first major point of confusion. The trademarked name O-Shot heavily implies a single one-and-done miracle injection.
Right, like you just go on your lunch break, get one shot, and boom, your tissue is permanently regenerated.
And while some clinics might try to sell the procedure that way, the clinical standard that's utilized in the actual scientific research is completely different.
Yeah, if you look at the methodology in those 12 studies for the systematic review, the most common protocol to achieve these significant results for sexual dysfunction is actually a series of 3 monthly sessions.
It's not just one.
Exactly. And they're utilizing roughly 2 milliliters of concentrated PRP per session, carefully mapped along the vaginal wall and the clitoris.
Because tissue regeneration is a biological process, it is not a mechanical switch that you can just flip. It takes time for those stem cells to migrate, for fibroblasts to lay down new collagen, and for new blood vessels to form and mature.
So setting the expectation that it requires a dedicated series of treatments over several months is pretty vital for anyone considering the procedure.
Absolutely.
But if a patient is undergoing 3 separate sessions, injecting 2 milliliters of fluid directly into the most sensitive, highly innervated tissue on the human body, the risk profile has to be a massive factor in the decision-making process.
Naturally.
I mean, the idea of a needle in the anterior vaginal wall is understandably terrifying to a lot of people.
Well, the physical injection certainly requires a very good localized numbing agent, but the actual safety profile of the substance being injected is perhaps the strongest medical selling point of PRP therapy.
Really?
Yes,
Yeah.
because it is an autologous treatment, meaning because it is spun entirely from your own blood, the safety data is just remarkable.
Let's look at that data. Across all 317 women monitored in that massive 12-study review, there were only 3 reported side effects,
That is less than a 1% complication rate across over 300 patients.
which is incredibly low. And the nature of those side effects is important to contextualize, too.
What were they?
Well, 2 women experienced temporary heightened or continuous arousal, which resolved entirely on its own without any medical intervention.
Okay.
And 1 woman experienced temporary urinary retention, which also resolves without further treatment. There were 0 severe adverse events, like no reported scarring, no tissue necrosis, and no localized infections.
And the risk of a severe allergic reaction or your immune system actively rejecting the substance is basically 0, because your immune system recognizes the plasma and the platelets as its own biological material.
It's an incredibly robust safety profile for an injectable medical procedure.
It is. But we also have to address the limitations. We promised the listener we'd separate the clinical reality from the hype. And the reality is that PRP is not a permanent, guaranteed fix for every single woman experiencing sexual dysfunction.
Right. Despite the really promising data, PRP for female sexual dysfunction is still officially classified as investigational by major medical bodies.
It has not yet been formally written into the official standard of care clinical guidelines for gynecology.
And there's also a pretty significant gap in the long-term data. The studies we reviewed today only tracked patient outcomes for up to 12 months.
Right. We know that tissue regeneration holds up beautifully at the 6-month and 12-month marks, vastly outperforming placebos and significantly improving quality of life.
But we have no data on what that tissue looks like at year 2 or, year 5.
Exactly.
I kind of like to think of it using a software analogy.
Okay, let's hear it.
The O-Shot protocol is essentially this early access, off-label tech update for your body's hardware. The initial reviews from the beta testers are fantastic. The upgrade clearly works. It rebuilds the mucosal tissue, increases the blood flow, and upgrades the nerve conductivity.
I like this.
But the developers, like the clinical scientists, they haven't released the final long-term patch notes yet. You are getting a cutting-edge biological upgrade, but you have to accept that the long-term warranty is still being drafted.
That's a perfect way to phrase it. We just don't know if patients will need an annual maintenance shot or if the neovascularization lasts a decade. We just don't have that data yet.
That is the exact reality of current science.
And, while we've focused our lens entirely on sexual function and G-spot sensitivity today, it is really worth noting that the regenerative power of this exact same PRP therapy extends well beyond just pleasure.
Oh, absolutely.
Yeah.
The sources highlight that these anterior wall injections are showing incredible promise for treating things like stress urinary incontinence or SUI.
Which is that involuntary leakage so many women experience when they cough, laugh, or sneeze, often due to weakened pelvic floor tissue after childbirth or menopause.
And the PRP is also being used to treat a painfully chronic skin condition called lichen sclerosus, which causes severe thinning and scarring of the vulvar tissue.
By injecting the PRP around the urethra and the affected vulvar tissue, those exact same growth factors rebuild the structural support and restore physical elasticity.
Now, obviously, surgical mesh slings remain the gold standard for severe incontinence, but PRP is rapidly emerging as this highly effective, non-surgical multi-tool for women dealing with mild to moderate pelvic floor issues.
It really is a fascinating convergence of cellular biology and intimate wellness.
It really is. I mean, we started this deep dive looking at a very murky diagnostic landscape. We reflected on the historical frustration of women just feeling like their bodies are these broken machines with no clear medical fix.
And being told it's all in their heads.
Exactly. But the O-Shot, despite its slightly catchy, maybe gimmicky marketing name, is far more than just a clinic gimmick. It is a genuine science-backed application of regenerative medicine.
By simply drawing a small amount of blood using a centrifuge to isolate and concentrate the body's own platelets.
Those microscopic cargo ships.
Exactly. And injecting those cargo ships of growth factors into the highly sensitive vascularized zone of the anterior vaginal wall, clinicians are triggering a massive cascade of localized healing.
And the clinical trials confirm it. It genuinely rebuilds thinning tissue, builds new capillary beds to increase blood flow, and improves the overall health of the local nerve endings.
Safely and significantly improving G-spot sensitivity, natural lubrication, and overall sexual function. And most importantly, outperforming the psychological placebo effect.
It represents a massive paradigm shift in how modern medicine actually approaches women's sexual health. Like, we are finally moving away from simply managing symptoms or prescribing daily pills and moving toward actually regenerating the underlying physical anatomy.
It's incredibly exciting.
It is. We've spent decades relying on synthetic interventions to treat female sexual dysfunction. But the ultimate key to restoring intimacy, to healing damaged tissue, and to reclaiming physical pleasure has literally been flowing through our veins this entire time.
Yeah.
How might the realization that we carry our own biological cure permanently shift the future of aging, intimacy, and female healthcare? Something for you to think about. Until next time.